this year, Seahawk Bobby Wagner has partnered with Virginia Mason Franciscan Health to teach more people about stroke in memory of his late mom. She sadly passed due to complications of a stroke. VMFH, Bobby, and the Seahawks have now teamed up with Hero Projects to create a graphic novel for kids and comic fans of all ages to learn about the signs of a stroke and raise funds to help stroke patients. And thus, FAST54 was born. And here to tell us more about it is Virginia Mason Franciscan Health neurosurgeon Dr. Roby Ryan and stroke survivor Michael Martinez. Thank you so much for being here, both of you.
Thank you so much.
Thanks for having us.
I mean, this is important. We've all heard FAST, but I think using it in the title of FAST54 is important. So let's talk about what FAST means and why learning it, even having kids learn it, is so important.
Yeah, it's been so exciting to partner with Bobby on this project. So FAST is an acronym, and it's used as a screening tool by everyone from medical professionals to everyone in the community. And it stands for the symptoms of a stroke. F can be the sign of the face drooping. A is arm weakness, if the arms are lifted up and one starts to drift down. S is speech difficulties. That means it's T, time to call. Yeah, and these signs, it's so important that we recognize them quickly because we think about an artery being blocked in the heart, someone's having crushing chest pain, people know that's a sign of a heart attack, they're going to seek care.
Right.
But we need people to help identify the signs of a stroke, because if an artery is blocked in the brain, neurons are dying at a rate of 2 million per minute while they're not getting a blood flow. But if we can quickly get to care, we have technology now to open up those blocked arteries to try and help people make a more full recovery.
Incredible technology that we have now, and maybe talk more about that later. But first, I want to ask you, Michael, recently Virginia Mason Franciscan Health invited you and your son to go to a Seahawks game. Your son is named Asher. There he is right there. This was on World Stroke Day back in October. What did Bobby talking about strokes mean to you as a stroke survivor?
Well, there's a lot. Well, I have aphasia. It's a communication disorder. And so I had a stroke. It's been 3 years. And at the time, I didn't know the signs of a stroke. So, but my face was droop, and I had trouble with my speech. So I went to the so my wife, she called 911. So I went to the hospital. Yeah. And the doctor, they were able to remove the clot. And so seeing the doctors and the nurse, they're really heroes. Yeah. You know? And so now I'm able to have a second life to be alive with my kids. Yeah. And so it means really cool. My son, he really loves books. He likes to read books. So when he was able to, he loves this comic book, you know, and he loves reading. And I think from that, he was able to have more of a aware of being a stroke.
You know what, and makes him realize that it's not just his dad, that this is something that we should all talk about. First of all, thank you so much for sharing that story. I know it's hard to think about and talk about, but I'm so glad that you shared what happened to you. And I'm just curious, the fund in honor of Bobby's mom, tell viewers what will happen today if people donate.
Well, yeah, it's very exciting. A big part of the stroke happens recognizing the stroke, getting the care, but then the recovery afterwards, as Michael's talking about. And one of the big things that will slow down your recovery is if you have another stroke. So one of the most important things you can do to prevent another stroke is to control your risk factors. That can be things like stopping smoking, checking your cholesterol, blood sugars, diabetes, but also blood pressure is a huge one. And the fund is really working to help get blood pressure monitors to people who might not otherwise get access to them. And that way you can check your blood pressure and work with your healthcare team to keep your blood pressure in a healthy range.
So important, thank you. So much. I found out I had high blood pressure recently, getting a cuff, it's not easy. It can be very expensive at the store. So I'm glad that this is what you're doing. Just before I let you go, how will the fund help support stroke patients specifically?
So it's going to identify people who have actually had a stroke, so we know that those are the people at the highest risk for having more strokes, and then especially ones that might not have access to resources, it's going to help get these type of resources to help prevent further strokes into their hands.
Yeah. How important is it for this recovery, for someone's recovery?
Yes, well, it's been 3 years, and so I have a stroke support group in Tacoma, in St. Joseph's, and Carmen and Jennifer, they're the leaders at the group.
Yeah.
And so, being at that group, I feel empowered.
Yeah.
And support by the group for growth for me.
Shout out to your group, shout out to all that you're doing. And y'all, listen, if you want to learn more about FAST54 and what we talked about today with Virginia Mason Franciscan Health, just visit the website you see right there on your screen.
This portion of New Day Northwest is sponsored by Virginia Mason Franciscan Health.